I'd like to go ahead and take this opportunity to introduce our Quality Improvement Director, Barbara Dahmer-Becker. Barbara, whenever you're ready.
Thank you, Manny. Next slide, please. So I'm going to start you off today with some CDC updates. We're a pretty small group, so please feel free to ask any questions you happen to have today. But we've gotten quite a few questions about when can we take a patient out of COVID precautions. And there was a recent update to the guidance as of July 17th, so I wanted to make sure we went ahead and covered that today. So we do recommend using the CDC guidelines for disposition of hospitalized patients. So this is a recommendation called Discontinuation of Transmission-Based Precautions and Disposition of Patients with COVID in Healthcare Settings. So there's no guidance specifically for dialysis, so we're just going with the healthcare setting with one. And I'd like to highlight some of the changes. It used to be that the CDC was recommending a test-based strategy. Well, so now, except for in very rare situations, the test-based strategy is no longer recommended to determine when to discontinue transmission-based precautions. For patients with severe to critical illness who are severely immunocompromised, the recommended duration for transmission-based precautions was extended to 20 days after symptom onset, or for asymptomatic severely compromised patients, 20 days after the initial diagnostic test. Other symptom-based criteria that were modified, they changed from at least 72 hours to at least 24 hours have passed since the last fever without fever-reducing medication. And they changed the verbiage from improvement in respiratory symptoms to improvement in symptoms. This is to address the expanding list of symptoms that are related with COVID-19. So if you have any questions on the guidance, feel free to drop it in chat, or you can reach out to me independently. And as always, we will keep you as up to date as we can as the CDC updates their guidance. With that, I'm going to hand it off to Brianna.
Thank you, Barb. Can everyone hear me?
You sound great.
Perfect. Just want to make sure. So today we're going to discuss how to overcome some of these transportation challenges during this pandemic. Next slide, please. So our objectives for today's presentation are to understand the transportation oversight process, to understand what information was provided to transportation companies, to highlight common challenges facilities are reporting to us, and to understand actions facilities can take to address challenges to transportation, in addition to identifying alternatives such as using ride sharing or use of volunteer programs. Next slide, please. So similar to the healthcare industry, the transportation industry has various levels of oversight. At this time, the Federal Transit Authority has been dispensing guidance down through their chain of command to address the challenges and meet the demands of the pandemic. This guidance includes recommendations from the CDC and OSHA, in addition to the Americans with Disabilities Administration, or ADA. This guidance is then shared with the state level authorities, updated in collaboration with the State Department of Health, and then dispensed further on down the chain of command. At each level, there is a process to report grievances and barriers to service. Many of you have been reporting to us. Next slide, please. Some recommendations that transportation agencies should have received include recommendations noted in the most recent FTA Safety Advisory. This safety advisory recommends that transit agencies develop and implement procedures and practices consistent with all applicable guidance and information provided by the CDC and by OSHA. The FTA's Public Transportation Agency Safety Plan regulations require transit agencies to incorporate these policies and procedures into new or established plans to manage the risks of this pandemic. Many of these procedures are similar to those in the healthcare industry, such as use of face coverings, routine cleaning and disinfection, and physical separations. Next slide, please. So we are hearing feedback from many facilities that transportation companies are refusing to transport COVID-positive patients. According to the FTA's frequently asked questions, a transit company should consult with their local public health officials to determine the circumstances for such denials. Some transit companies are also refusing to transport recovered patients unless they have a negative test result. Sharing test results of any patient is not appropriate unless the appropriate privacy clearances and disclosures are in place. What you can do is refer them to the CDC guidelines for the discontinuation of transmission-based precautions, which we highlighted earlier. Next slide, please. We have found that the key drivers of refusals to transport are a lack of knowledge of infection control and prevention practices, a lack of training on these practices, and a lack of understanding on where to find resources. For these drivers, we have listed guidance you can refer transportation organizations to during your conversations, which should help. An especially useful resource is the Federal Transit Authority COVID Resources Tool. This resource, updated regularly, is a great resource to refer agencies to. It's quite comprehensive. It details the sanitation and PPE and physical distancing requirements, but also other industry-specific information. Although it is outside our purview to provide oversight and training to these organizations, it is in the patient's best interest that we collaborate on solutions. Next slide, please. Another challenge includes the misalignment of hours of operations. Many COVID patients are dialyzing on third shift. This is a best practice for infection prevention. However, during those times, many transportation companies often do not offer services. Similarly, staffing shortages or surges in demand are also impacting the availability of services. Next slide. Many of these challenges can be addressed through constructive conversations with transportation company leadership. Although the sharing of earlier reference material, along with sharing the earlier reference materials, you may want to review any current contracts with your transportation company. Work with these companies to understand the medical necessity and the importance of timely treatment for dialysis patients. Another recommendation is to invite transportation companies to discuss opportunities to improve already existing systemic challenges. Some ideas to discuss could be transportation companies establishing a reserve shift for dialysis patients, or considering technologies you can use, such as like a shared dashboard, to help with communicating any delays in transportation in real time, and also inviting these companies to attend and participate in quality improvement meetings. Next slide. Even with our best efforts, challenges can remain. During a disaster, you can get more support from emergency operations centers. On each of the network websites, we have provided a list of emergency contacts for each state if you're in Network 16, and for each county if you're in Network 18. Go ahead and go onto the website. It's under the emergency preparedness page, and then scroll down about halfway down the page. You'll see a selection for your location, and if you open up that PDF, the contact information will be made available. During this time, it's important to report persistent issues with transportation to your local emergency operations center. It is likely other types of medical clinics in your area are experiencing the same issues, and they will have oversight and authority to intervene. Similarly, it's recommended that you reach out to your local healthcare coalition for additional support. Their contact information is located in the hyperlink documents shown in these screenshots. In most emergency response plans, the transportation of infected persons is often assigned to the local fire department. This is a general principle which may vary in each city or county. So please do take a moment to contact your local fire department for additional support or recommendations. Next slide, please. It's important to note that your clinic is not a transportation company. Although we share details on the oversight process, resources used, and contact information for support, we must remember the power of patient self-management. Patients are free to reach out to friends, family, and their community for support. When patients have a sense of control, they are more likely to adhere to their treatments. We recommend providing additional education and training to patients to help them be more independent. A new resource developed by our social worker, Lisa Hall, was recently published on our Network LMS website. This is a tip sheet to help support patients to schedule their treatment times so that it best meets their needs. Please log into the Network LMS system to access this and other great resources. It has also been reported that some patients are not able to pay for their transportation. If this is the case, please refer the transportation companies to the Department of Transportation to discuss funding opportunities which have become available as a result of the CARES Act. Next slide, please. Other alternatives include using Aging and Disability Services van pool volunteer programs. Again, the hours of operation may need some focused coordination. Should one of these organizations have any questions regarding infection prevention or operating services during a pandemic, you may refer them to the CDC guidelines and also refer them to the National Aging and Disability Transportation Center's resources. We have highlighted their pandemic guidance here. Another alternative is to consider supporting a patient-for-patient transportation collaborative with consideration given to protect patient privacy and safety. A program such as this may be more challenging to implement in larger urban areas. However, in smaller communities with limited resources, this may be less challenging and worth considering. Next slide, please. One of our facilities noted that they were having challenges, and their solution was to hire a private transportation company. In their case, they hired a private shuttle. In a pandemic, it's important to think outside the box. In Washington State, a taxi can adjust their billing practices for routine medical services through a contract with a non-emergency medical transportation company. Contact your local Department of Transportation or EOC to learn more about the options that are available in your area. Many clinics are already familiar with using ride-sharing services for patients as well. These companies have also adjusted their operations to include implementing infection control and prevention practices and ongoing training for their employees. They have also adjusted their billing to accommodate routine visits to clinics. I encourage you and your patients to consider utilizing these services where they're available. And lastly, it's okay to remind patients experiencing difficulties to reach out to their neighbors, their friends, and their communities for support. And should they have any questions regarding infection prevention or transportation best practices, please feel free to share the resources we have discussed today and are also noted on the reference slide. Next slide, please. A copy of the slides and the recording will be made available on the ESRD Network LMS system. With that, this concludes this presentation. I'd like to open the lines up to see if there's any questions. No questions. Any questions about anything at all, COVID related or not COVID related?
I don't so much have a question as more of a statement. I'm always a little bit leery about paying for transportation services, so I don't get into conflict with the, what is it called? The undue inducements, I think it is, from CMS. So if we pay for it as a provider, for some patients, that could be construed as we're, buying basically patients.
So this is Barbara. If you are in a situation where you think you need to do that, by all means, reach out to the network. We have intervened and advocated for both the facility and the patients with the state surveyors. to make sure in times of emergency or severe need that it is not seen as an inducement.
Thank you.
Excellent question. Any other questions? Okay, well, it looks like we have a short meeting today. Please hang on the line, and Manny, would you mind posting the poll? Once you are finished with the poll, we'll let you go and look forward to speaking with you again soon.